In the spring of 2013, Patalul, a Guatemalan community that sits in what was a hot zone for onchocerciasis, or river blindness, celebrated the death of the disease after its transmission cycle was broken, thanks to Guatemala's Ministry of Health, the Carter Center's Onchocerciasis Elimination Program for the Americas, OEPA, and a coalition of strong partners. After 3 years of post-treatment surveillance, the World Health Organization verified the disease has been eliminated from Guatemala, once the most endemic country in the Western Hemisphere.
River blindness elimination in Guatemala is a real milestone. Many people have suffered from this condition through the decades.
A skin and eye infection that causes unbearable itching and can lead to blindness, the disease is spread by the relentless bites from a black fly that breeds in streams and rivers, often the same waters that irrigate these Guatemala coffee plantations, or fincas.
Guatemala had a tremendous tradition in finding the way to control and to eliminate this disease. The first initial studies were done here in Guatemala, and specifically this finca, Tarrales, where we are right now.
This is just about ready.
When his father died, a young Andy Burge took over Los Tarrales. In the 1980s, Burge welcomed mobile research and education troops who aimed to get the disease under control by treating Guatemala's plantation workers and their families with ivermectin. Those preventive treatments with a drug known as Mectizan, donated by Merck, in conjunction with health education efforts sponsored by OEPA, delivered the 1-2 punch that ultimately turned the tide against river blindness in Latin America. Colombia, Ecuador, Mexico, and now Guatemala have eliminated the disease. The only places it remains active are in isolated pockets along the Brazil-Venezuela border. Guatemala has another special connection to river blindness through its own Dr. Rodolfo Robles. That's him on the big banner at this art and education exhibit in Patalul. In 1915, he discovered Guatemala's first case of the disease. A century later, Guatemalans have seen the last of it.
¿Están contentos que se haya acabado la filaria?
Sí! Yes! 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 Gracias. El día sí se